Hello, nice to see everybody here. Some faces I recognize and many new faces. I'm Gail Chodron. I'm a social scientist in public health here at the Weissman Center, and I work in the part of the Weissman Center that focuses primarily on community services, community training, and community outreach. And another important thing to know about me is that I'm a parent. I love to put my daughter's picture on the slide along with these other beautiful children. So she is now a 22-year-old autistic adult. But a lot of the focus of my earlier work up until now has been on early identification, because that was such an impactful thing in our experience. So I like to bring the personal lived experience together with what I research. But I obviously am very much now learning about and learning from my daughter about transition and adulthood. And I'm very eager to hear from the autistic adults who will be speaking shortly. So I will try to stay within time. So I'm going to focus on early identification, as I said, and really I'll briefly go over what we know about early identification right now, and then what I've been working on with colleagues to improve early identification. So we're fortunate to have quality data on the prevalence of autism from the Wisconsin Surveillance of Autism and Other Developmental Disabilities System, which is housed here at the Weissman Center. And based on the most recently reported data, 1 in 53 8-year-olds and 1 in 56 4-year-olds in Wisconsin meet the criteria for autism. You can see that we are getting data on 4-year-olds when we didn't used to have that. So that is also nice. The prevalence of autism in our state has increased over time, which I know probably everyone here is very aware of. So you can see those numbers going from about 5 out of 1,000 children in 2002 to almost 19 in 2018, 2018 being the most recent data collection year that's been reported on. Efforts to ensure that all children with autism are evaluated and diagnosed as early as possible can help families like ours connect to services to support them and their autistic children as early as possible. So we do seem to be doing a better job at identifying autism early. In Wisconsin, the data here is, there's a wonderful data visualizer now offered by the CDC. So I was exploring that. And in Wisconsin, children who were born in 2014 were over 2 times as likely to receive an autism diagnosis or autism special education classification by 48 months of age than children born in 2010. So I've highlighted those points there. However, there's still plenty of room for improvement. Overall, only 48% of Wisconsin children identified with autism received a comprehensive developmental evaluation prior to age 3. It's important to note that in this study, comprehensive developmental evaluation actually is inclusive of an evaluation completed for birth to 3 services or for special education services or a diagnostic appointment. So it's pretty comprehensive. It always feels really important to me to point out these access points and these pathways to access services and different kinds of services. This highlights why it's important to improve early identification as well. So a clinical diagnosis is needed to confirm or rule out autism, as I'm sure most people know here. It's usually needed to access autism-related services covered by public or private health insurance. And we know it can take many months, especially with things like COVID-19 impacting services, to access a clinical or medical evaluation. And part of that is a shortage of qualified diagnosticians compared to the demand. An educational evaluation is completed to determine eligibility for educational services. And because both birth to 3 and special ed are covered by IDEA, or the Individuals with Disabilities Education Act, I'm putting them both on that path. So it's important to recognize, though, that in that pathway, there are time periods that the evaluation must be completed within. So for example, the school district has 60 days to complete an evaluation for special education eligibility after the parent has made the request in writing. So this pathway at least is something where we can, if we're identifying early and referring into that pathway, there is more timely follow-up. So before children can ever receive a referral for evaluation, however, we have to recognize that there is a developmental concern. There's something that we want to look at more closely. So I want to point out that there are two key steps we can take to recognize developmental concerns. These are developmental and autism monitoring and developmental and autism screening. So developmental monitoring means we're observing how a child grows and changes over time. We're using objective, standardized knowledge about typical milestones and how many children reach those milestones at a particular age. This helps us notice whether a child is reaching the typical milestones and how they play, learn, speak, behave, and move. And, developmental monitoring is fabulous in that parents, grandparents, other caregivers, childcare providers, anybody who's interacting with a child in addition to a doctor can play a role in that, because we can all be knowledgeable and observe. Developmental screening takes a much closer look at how a child is developing using a more formal tool. So developmental screening, autism, I'll pause for autism screening. Developmental screening can be done by a doctor or nurse, but also other trained professionals in healthcare, community, or school settings. Most developmental screening tools require a specific amount of training. Autism screening is a more specific screening that looks for signs of autism in particular, and there are some that are much lighter in terms of the demand for training, although it's always helpful if someone is also trained in how to do screening in general, so they don't misunderstand what it is. Okay, I want everyone to know, this is always a big plug for me, that physicians are expected to screen and monitor in their pediatric practice. So the American Academy of Pediatric recommends universal developmental monitoring, developmental screening, and autism screening. Universal means every child at routine ages. So you don't wait for a concern, you use this tool to sort of elicit information about whether you should be concerned. So pediatric healthcare providers are also supposed to conduct additional screening if any concern is raised, whether by their own monitoring or whether a parent brings a concern to them. Even though these recommendations were first issued in 2006 and they've been updated more recently, universal developmental monitoring, universal developmental and autism monitoring and screening aren't happening. So one study that used Parent Report found that only about 30% of children under 3 years old received any screening for their development. And if you look at the set of things that's supposed to happen, the developmental monitoring is supposed to happen at every visit, developmental screening at 9, 18, and 30 months, autism screening at 18 and 24. So by 3 years old, there's quite a bit of screening that should have happened, but only 30% of children under 3 have parents who are saying, yeah, that happened for us. Now, those parents weren't asked, did you have a developmental screening? They were asked a proxy question, or a question that would sort of help elicit whether they'd had a screening, because not everyone knows what that means. So perhaps it's more useful to look at healthcare providers and what they say they're doing. They certainly report that they're doing developmental and autism screening more than what the parents say. In one study, they report conducting developmental or autism screening for between 40 to 60% of their patients, depending on the age and of the visit. But overall, fewer than 18% of those providers responding agreed that they comply with the full set of recommendations, the things that are the standard practice that they're supposed to do. There are a number of reasons, I don't cover them here, but there are studies on what are the barriers and the amount of time in an appointment, the difficulty of actually integrating those processes into a healthcare system, and the fact that one individual doctor doesn't always have the control over whether a system is integrating it or not, are certainly concerns. So we talked about let's see. For autism screening in particular, some of the obstacles that have been identified are, again, the limited time, but also the limited knowledge about early autism signs and symptoms, and discomfort talking to families about autism concerns. Many primary care providers are not specialists in this type of area. So there's a good bit of work being done to try to identify what will help physicians to do this better. So I want to focus the end of this presentation on other community providers. So research and what can they be doing, right? This is something we can take action on. Research has shown that community-based professionals can play an effective role in developmental monitoring and screening, and targeted training on developmental monitoring and screening can further help community providers to identify developmental delay. However, in this world of early childhood work, there are very few programs where there are professional guidelines that say you should or you must do developmental monitoring and screening. Head Start is one place where there is, but in many other cases there aren't. Childcare programs can opt into a quality rating system or become accredited, and then it would be required or encouraged, but it's much different than in healthcare. But because of the large number of children who are in childcare settings outside of their home, this could be a really great place to take action and see some improvement while we simultaneously work on making sure primary care providers are monitoring and screening. So we did know that childcare providers in particular are not always receptive to developmental screening and playing a role in early identification. In one large-scale study in Minnesota, around half of the childcare providers reported they don't believe developmental screening in particular is part of their role. And over 70% said screening should happen someplace else. In our work on the ground here in Wisconsin, we did hear providers, childcare providers saying it felt like they were giving a diagnosis. It felt like they were saying your child has autism, and that was really scary to them if they were doing autism screening. So because developmental monitoring is a less formal process and requires less training than developmental screening, there's good reason to think we could improve early identification by increasing community-based developmental monitoring. When monitoring leads to a concern about a child's development, community professionals can then say, take this to your doctor and ask about next steps. So we've carried out several implementation studies to better understand how feasible, acceptable, and effective it is to integrate developmental monitoring into various early childhood programs, including center and home-based childcare programs, early Head Start, and home visiting. So today I wanted to not go into depth in one of those studies, but to give a little bit of a picture across to build a sense of what we can be doing in the community and what we've learned about what's effective. We use the Learn the Science Act Early materials, which are evidence-informed materials to support developmental monitoring. So these provide information about what are the typical milestones, when are moments when you don't need to worry, and when you might worry more. There are a range of materials shown here for family, including checklists, books that show all milestones from 0 to 5, children's books. I saw the Autism Society had some other children's books about autism, which was fabulous, and even a mobile app. There is a separate set of materials that is developed and provided for providers. This includes print materials specific to them, like tips for talking to parents, right? It's hard for many people to know how to share those concerns. It also includes training materials. One example that we've used in our studies is here, and that's for childcare providers. I'm going to share a few results and what we've learned from 3 different studies. The first of which is going to be on 2 slides because it's 2 parts that I'm talking about. So most of the studies I have been doing are implementation. We get on the ground and do the work, right? But before we implemented with childcare programs, we also did a larger scale survey to learn about their attitudes, knowledge, and current practice, right? So we'd understand what we were intervening in. We surveyed providers in Wisconsin who were going to participate in implementation and providers in multiple states who were not necessarily going to. So this was interesting. We found that many childcare providers surveyed think developmental monitoring is important. That's great. Almost, 92% of them, but of them, only 60% said they do it. 80% of the entire sample said they reported doing developmental monitoring, but not for the purpose, I'm wondering why those numbers seem weird to me. But anyway, but not for the purpose of identifying developmental concerns. One of the things we found out in the childcare sites is they will watch development and keep track, but it's often for monitoring progress or individualizing instruction, things that are much more part of the childcare setting. 20% of the respondents said they could not identify any place to refer a child if there was a concern. They didn't know where to turn. And only 25% knew to refer to both of those pathways, right, to the doctor and the early childhood services. So many families are not getting any referrals, or they're only getting part of the picture. They were definitely much more familiar with referring children to early childhood services than to the doctor. We definitely learned when we were comparing the practices they reported and their attitudes, we saw that knowing that their attitudes were supportive definitely didn't mean that they were able to or were taking action on doing developmental monitoring. So then we provided training for the people who took the survey in multiple states. They did the training on their own and then did a post survey to measure change. That was the same for the providers who we were going to go in and implement with. So this was the Watch Me, Celebrating Milestones and Sharing Concerns training, designed specifically for early child care, early care and education professionals. So I want to point out a couple of key findings. The training did statistically significantly increase the priority that was placed on identifying delays, sharing concerns with families, and making referrals. So we were really pleased with that. Also, there was a significant change in knowledge about the steps of developmental monitoring and what referrals to make when there was a concern. There was a trend, but not statistically significant, toward there being a greater impact for home and center-based childcare providers than Head Start, but that was because of what we might call a ceiling effect. The Head Start providers started out pretty well at the beginning. They have a good bit of training and they do this often, where other people had more opportunity to learn, but that helps us know that it's worth going into those settings. So targeted training can help. We didn't have sites that were Head Start or early Head Start in our implementation in that study. So we did a follow-up where we went into early Head Start. Early Head Start programs work with children who are 0 to 3. They provide both center-based and then some home visiting model services. So overall, we just they found it really easy to use these materials. They did use them, almost all used them. They chose the books and the mobile apps. So 74% of managers reported that their programs did not experience barriers, and 28% of the parents had a concern about their child's development and then followed up with a professional. And of those 50%, 51% said the materials helped. So that's good news. Materials were pretty easy to use. So great to get some benefit there from something that's not a heavy lift. Finally, we've been looking a little bit at home visiting. This is more of an implementation project with some evaluation data collection. But because I want to paint a picture of all the ways we can intervene in community identification, I wanted to highlight this. So this isn't Head Start early home visiting. This is home visiting in general outside of Head Start. So in Wisconsin, it's Family Foundation's home visiting. And they used the books and the mobile app. Many of the home visitors did share the materials and then reviewed them in the home visit with families. 68% of the families reported using those books, which was lovely, and most of them really enjoyed the books. Many fewer families reported using the mobile app. Tech isn't always the most fun thing for people to use or most intuitive. And the barrier that really got in the way was not enough time. Obviously, there's a lot to do in a family's life. So these were families in general that didn't have a child identified, of course. So it shows that in another setting, this is a promising tool that could be used. So I will pause there. The time goes by very quickly. There's a lot more I could have shared with you, and I'm happy to answer any questions that you have. Oh, Nancy.
My experience with early identification was kind of unusual because my son is now 44 and he was identified, I knew he was autistic at 18 months and Wiseman identified him formally at 2 years. But he was in a daycare center that was a religious private school daycare. And they took data on what he was doing that was different from the other children, but they had no referral or any other kind of information for me at that time, because that was in 1980. And their only advice was I must remove him from their facility. And what happens now in these private schools? Are they accepting kids with disabilities?
That's a really good question. I can speak briefly to when my child was that age. Years after your son was, but my child likewise was invited to leave so many times and kicked out so many times. Like you, the preschool knew something was different, but even though they'd had an autism training, sadly, as a pre-service before the year, they didn't think of that. But they were, decent at knowing to talk to someone, at least one of the preschools was. So I think it's an ongoing challenge. I wanted to point out that in early care and education settings, what I've noticed coming out of health and public health is that there's actually kind of a little bit different point of view, just different in terms of what they're familiar with, what they're looking at, how they think about this child that they're spending so much time with, and that there's a lot of attentiveness right away to what can we be doing with this child every day in the site we're in. And they don't necessarily know all of the more health related things out there. One thing I want to say that's very important is that it's not simply a matter of a child being identified or not identified. There are also ways in which children are misidentified. So we know that's, so a child care site that notices something's going on might really misinterpret what it is and intervene in the wrong way. My child, for instance, read many books with the director of the childcare about hands are not for hitting, but really not understanding what was going on with this child. And in Black and Brown communities, there's much more tendency as well to label a child as having a emotional behavioral condition, oppositional defiant, or other mental health that might be actually co-occurring perhaps, but really missing the point of what's going on developmentally, which is really important to have an accurate picture of. So, yeah, Teresa.
So, Gail, I have two questions. First, has the training of pediatric physicians changed to include training and screening for autism?
The question is, has the training for pediatric providers changed to include training on screening for autism? I think there's much more training than there was, and certainly the American Academy of Pediatrics tries to make that even more possible for pediatricians and other healthcare family medicine at whatever stage they're at, by having quality training materials and offering continuing education credit or maintenance of certification, another way that pediatricians and family medicine need to continue. But I think it continues to be a challenge that there's a great deal to learn during medical school. And if you saw the periodicity chart, the when do you screen for different things, you can barely read the words because there's so many words on it for so many different things that they're expected to do. So understandably, it's quite hard. I think at this point, making more progress will have a great deal to do with understanding implementation within systems and intervening in a system level to make it easier for those folks to do what they've learned could and should be done. And the other question online?
The other question is a two-part.
Okay.
The question plus a comment. Why is there such a significant increase in children being identified with autism? And she followed that question up to say, it's incredibly frustrating for families to get this early diagnosis and then not be able to access programs to address it. Early intervention is so important. Parents hear that all the time, but then they can't get the services they need.
Yeah. So the question had two parts. Why is, what is the cause, or why is there increase in the number of children? And then a comment about the challenge with actually then accessing early supports. Yes, and I wish neither were the case, and I wish we had answers for these. Neither of these are specifically my area of expertise, but being in a training role, we cover a great deal here. So I think there's plenty of evidence that autism, the prevalence of autism is actually increasing and reflecting changes in how many children are experiencing autism. And we have evidence that suggests that there are other factors as well, like a more accurate diagnosis or label for things that were classified in a different way in the past. I once asked an OT at one of Aiden's schools, grade schools, whether she felt that she was seeing more children like this, or whether it was just a shift in what the label was used. And she felt like in her everyday experience, she definitely was seeing more children. The second question has become, or the second part of that question, the comment has become harder for me to think about. And I'll be honest about why. There's plenty of evidence that early intervention is helpful. Some of the evidence on earlier intervention actually is evidence about general early intervention, not autism specific. And then there's a great deal of evidence about the ways we can intervene early for a child with autism that are helpful. One of the reasons this is more difficult for me to think about now and answer is because my daughter is 22 and she is very vocal and insightful about the things that she feels were helpful to her and supported her to meet goals that were important to her. Fortunately, I didn't mess up too much, but there's a fabulous article out in the December Scientific American journal talking about a peer-reviewed journal article from Geraldine Dawson, an autism researcher in North Carolina, just helping us reflect on intervention and how we approach that, and how important it is right now to really be focusing on what are the goals that the family has and the individual has. Obviously, when my child was 2 or 3, or our children are young, we don't know what their goals are yet, although they're always communicating in multiple ways through their non-verbally and verbally. But that's something I'm chewing on a lot as my daughter helps me understand how important her mental health and her dignity and her self-valuation are, which I've always known. But now I can see the ways in which different things that happen impact that. So that was not an answer in any way, shape, or form to the comment, but just a point that I think is valuable to share. And I see that it's 6 minutes after, and I just want to make sure we're moving along so that we can give plenty of time to the other experts who are going to be sharing with us. So thank you so much.